Hey, I want your opinion. Are these videos too long or too short? So I am going to make a very short video on prolotherapy now. I just tend to tell stories that I think are helpful, but if you feel like the videos are too long, just give me a comment, or if you're like, Doc, I'm just telling you, man, I learn a lot from the stories. So prolotherapy can be done in all the parts of the body. The term was coined by Dr. George S. Hackett, a trauma surgeon from Canton, Ohio. In the 1950s, he taught Gustav Hemwall from Chicago. They met at an AMA convention where Dr. Hackett was showing his research on the effects of prolotherapy to grow ligaments, tendons, and how effective it was for chronic low back pain. That's kind of where it started, chronic low back pain. Dr. Hackett died in 1969, and Dr. Hemwall then took over the gauntlet. So Dr. Hemwall was prolotherapy until his death in 1998. I joined Dr. Hemwall in his practice in Chicago in 1993. So I've been doing prolotherapy for 30 years. And I was with him from 1993 until his death in 1998 at the age of 90. So when I joined him, he was 85 and I was 30. So I was the young associate, and almost every day I think about making him proud. So I hope that when I meet him in heaven, that he'll be proud of me, that I did a good job carrying on his caring, kindness, love, and of course, advancement in prolotherapy and the treatment of human disease. So prolotherapy is a non-surgical regenerative injection technique that introduces a small amount of solution, typically hypertonic dextrose, around joints to the site of painful and degenerated tendon and ligament insertions to induce these structures to repair. Somebody might say, well, isn't that a sugar? Well, basically, diabetes is when the sugar can't get inside the cell. So when you eat broccoli, you eat carrots, basically the digestive tract breaks those structures, breaks those substances down into the simple sugar D-glucose, which is different than table sugar. So all the cells of the body, including your brain cells, bone cells, ligament cells, the energy that they get is from primarily oxygen, that's why we breathe, and D-glucose, that's why we eat. So we eat to break down our food into D-glucose. So when you have a ligament injury or you have a joint injury, basically cells break open and they release the D-glucose. Dextrose, it's called dextrose. So thus, at that place where there's a ligament injury, there's a lot of hypertonic dextrose or dextrose in a high concentration, so that attracts the immune system cells there. So say you have a knee injury, like your knee's hurting and you have ligament injury there causing knee instability, because there's knee instability because there's clicking, popping, grinding, then you would want to gently, safely, naturally stimulate the same mechanism that the body uses to heal the ligaments. So the way you do that is to inject hypertonic dextrose, D-glucose, into the area to stimulate healing. Then if that doesn't work, you may add other substances such as a sclera, which attracts platelets, or you may just inject platelet-rich plasma, PRP, into the ligament area, because the platelets have the growth factors, including fibroblastic growth factors. So the fibroblasts are the cells that basically synthesize the collagen, which makes the ligaments. So prolotherapy comes from the word proliferate. So you're trying to proliferate the fibroblasts that grow the ligaments. And this is what it looks like under a microscope. So ligamentosis is there's a deficiency of cells. Then we do prolotherapy. Cells rush to the area because of the hypertonic dextrose or the platelets. And then the goal is to make a normal ligament or a tight, thickened ligament. And you could do the same thing for tendinosis, tendinitis, normal tendon. Other definitions of prolotherapy. Prolotherapy is the injection of a proliferant into injured tissues for the purpose of repairing it so its function is restored. Prolotherapy is an injection used to resolve ligamentous joint instability, meaning that when a person's walking or doing things, the bones are moving too much, and they're moving too much because the connectors of the bones, the ligaments, are lax or weakened. So prolotherapy injections to there thicken and tighten the injured ligaments so they are strengthened enough so the bones they hold together move correctly. When the bones move correctly, the pressures inside the joint are normal. When the bones move excessively, there's excessive pressure, and it's that excessive pressure that causes the cartilage to deteriorate or the disc to deteriorate, and eventually a person gets osteoarthritis. Now, when a person has a mildly loose joint, you could do exercise and posture and different things to resolve the pain, but that doesn't mean the ligaments have been repaired. The treatment to repair ligaments to resolve ligamentous joint instability is prolotherapy. So this is what it looks like pictorially. Normal joint, you get a ligament injury here. That ligament injury leads to excessive bone movement when the person's doing activities. Then the cartilage starts to wear out, and it's a progressive disorder. Much like if you open the cabinet door and it jingles, you know the problem is in the screw. It's not in the door. You don't replace the door. So this process doesn't need a joint replacement normally. You just need to tighten the screw or repair the ligament. So prolotherapy injections are done all along the ligament, especially where the ligament attaches to the bone, because the ligament grows from the bone out. So that's why prolotherapy shots are at the entheses, and it induces fibroblastic proliferation, and that's what it was originally called by Dr. Hackett, fibroblastic proliferation. Then he eventually called it prolotherapy. And then what prolotherapy does is it resolves joint instability. So this is how we document in the office, Caring Medical, the Hauser Neck Center, ligamentous joint instability. See how the bones are pulling apart. So prolotherapy would be done where the medial collateral ligament here attaches to the bone, and then we could document the improvement in the stability with ultrasound. So when somebody has ligamentous joint instability, prolotherapy adjusts the joint instability portion, but if there's postural things or muscle weaknesses, there are times that you need to correct the spinal curves with exercise or do a monitored exercise program to rehabilitate, the quadriceps, the glutei, and then sometimes you need chiropractic adjustments. But in general, what is needed to resolve ligamentous joint instability is prolotherapy. And then again, if you don't tighten a loose hinge on a door and you keep opening and closing the door, the next hinge is going to get loose. So prolotherapy is a progressive disorder. If you have knee instability, by definition it means with every step the tibia, fibula, the femur bones are moving too much. So eventually the forces go to the adjacent joints, and if you don't stop the forces on those adjacent joints, the increase in forces, then those joints are going to get loose. So if you're somebody who's like, geez, I had a hip pain, now I got a knee pain, then I got an ankle pain, or I had a little spinal pain, then it went down, or you had a neck pain, now it's the neck and the lower back hurting. It's all from ligamentous joint instability, so it does have to get treated, or else it's a progressive disorder. And ligamentous joint instability can cause all kinds of things. So the body spasms muscles, swells the joint, or bone spurs occur. So it's the body trying to stabilize that joint. So if your neck is always stiff or your back's always stiff and you get massages but it doesn't resolve it, it's probably because you have ligamentous spinal joint instability and the body's contracting your muscles to try to stabilize that area. So the treatment should be geared toward tightening, thickening the ligaments to resolve the joint instability. And these are all the different things over the course of 30 years. I've had access to prolotherapy, obviously. Look at all the different parts of my body that I've had prolotherapy. And anybody who knows me, I've done 5 Ironmans, I bike, I swim, I run, I play golf. You know, I've had a very full life, but I'm so grateful that I had prolotherapy. My dad and I were in a very bad car accident. This was before you wore seatbelts when I was 14. So the first area I got prolotherapy on was my neck in 1992. So I got prolotherapy 31 years ago, and pretty much it's been successful in every body part. So the criterion to know whether or not you're a good prolotherapy candidate: do you have ligamentous joint instability? Do you have a desire for recovery? There's no underlying severe medical conditions which significantly interfere with healing. So say somebody has breast cancer and their back's killing them and they don't have metastases in the lower back, you can get prolotherapy, but obviously the person's going to heal better if the person just has low back pain. Like they don't have another medical condition that can hurt their healing. Obviously somebody who has rheumatoid arthritis or like a cancer, they may be on treatments that suppress the immune system. So they can get prolotherapy, but it's probably going to be a slower healing time. They may need more visits of prolotherapy. I've had patients who've had metastatic cancer that have gotten rid of their pains with prolotherapy. Not pain from the cancer, but you know, somebody who has cancer or rheumatoid arthritis, they can still sprain their ankle, right? You know, they can still just have a ligament injury. It isn't like every ache or pain is from their condition. And I'm sorry I just went off on a tangent and it's making this video longer because I'm supposed to stay focused and not have this video be 45 minutes. So, okay, so the ability and willingness to follow instructions. What that means is that if you put the right forces on the ligaments after prolotherapy, you optimize the healing, tightening, thickening of the ligaments after prolotherapy. If you put too much force on those ligaments, they're not going to heal as good. Those instructions are given at the time of prolotherapy. Basically, all those things are from Dr. Hackett's book. So if you want it, you could still get Dr. Hackett's book. It's called Ligament and Tendon Relaxation Treated by Prolotherapy. That's available on the internet. And then we'll just watch some prolotherapy of the lower back. So you could see the needle going in, Some doctors do it under ultrasound guidance. Some doctors don't use ultrasound guidance. So depends on the doctor and the PA. So in the United States, nurse practitioners, osteopaths, medical doctors, and in the state of Florida, even doctors of oriental medicine can do dextrose prolotherapy. Then in 14 states, naturopathic doctors can do prolotherapy. So prolotherapy injections go down to the bone, and you know, this is doing the sacroiliac joint. So Danielle here is doing an aggressive prolotherapy treatment of the sacroiliac joints. So the shots are done where the ligaments attach to the bone. So she's hitting the bone, hitting the bone, hitting the bone, and yeah, then now she's going like inside the sacroiliac joint. So you do the periarticular structures, like in other words, you go around the joint where the ligaments are, and then you do the inside the joint. Typically, prolotherapy is done about once a month. The average person needs 4 to 6 visits. When a person comes for a new patient eval at our office, we try to give them as accurate as we can how many visits it's going to be. So if somebody has mild instability, we might say 2 to 4 visits. If they have moderate instability, we might say 4 to 6 visits. I have some people recently, because I specialize in prolotherapy of the neck, to resolve ligamentous cervical instability that can cause anything from heart problems, stomach problems, intestinal problems, brain fatigue, chronic fatigue, migraine headaches, neck pain, head pressure. So I've had patients in the last couple of weeks where I've said it's between 10 and 15 visits, because that's how severe the instability is. But if you have ligamentous joint instability that you believe is causing your symptoms, then definitely look at prolotherapy as a treatment to resolve your symptoms.